I look after Microsoft's healthcare business in Asia. It's something I've been very deeply passionate about probably for the last 10 to 15 years of doing it. I originally started as a software engineer, but became enamored with healthcare after my... That is something that is so meaningful for you as well, and we all have our own stories and why we do what we do. But I think deep down in our hearts, we all want to do something that makes a big difference. I want to open with this little video for you, just to give you a bit of a scene set on why the transformational impact of technology is so important. Can we have some audio, please?
When I lost my eyesight, I thought that my painting days were over.
How far can we go?
By using your hands, you can actually control your X-ray.
Technology has the power to unite us.
Hang on, honey. Hang on.
There he is. You see him?
I can see him.
It inspires us. Technology has taken us places we've only dreamed.
Now I can do whatever I want.
It gives hope to the hopeless.
Can you hear me talking?
And it has given voice to the voiceless.
It really is quite powerful what the human's like, and I think it really is incredible the kinds of things and the journey that we're on. In my travels around Asia over many years, I've seen some incredible things. Here is a famous hospital in Seoul, in South Korea. The outpatient clinic there, it's not unusual for a doctor to see 170 patients a day. Now, one of the speakers before spoke about how hard it is to do clinical documentation if you're seeing so many people. So they're really having to think about how to use technology to do documentation while still supporting the patient and doing this 2-minute medicine model. It's a really challenging thing, but the shortage of doctors and nurses in Asia is a really, really big thing and is not often well understood by the West, who, by comparison, really has some luxury. I love this country because this country has significant healthcare issues, but it has significant innovation because of it. And when I spend my time here in India, and I've spent a lot of time here, what I love about it is the innovators and people like you in this room are thinking about the problem of the healthcare system in different ways. Not because you don't like the West system and their flash hospitals and all those kinds of things, they're all really good to have, but really what it's required is we can't build a healthcare system like that because it doesn't even work in the West. They're going broke just trying to maintain the systems they have. So the way in India and how you challenge yourselves and how you think differently about healthcare and how you're building new models of care and new ways of doing things is really the innovation that'll drive impact. And a country not far north from here in China, I've also spent a lot of time in. And when we think about waiting list issues, they've got significant waiting list issues in their outpatient clinics. One of the hospitals here, I took this photo a number of years ago, is the Beijing Cancer Hospital. It's not unusual to see 2,000, sometimes 3,000 people waiting at their outpatient clinic, people with IV drips in the car park. There is so much demand and so little ability to be able to serve it all. How do we do that? And so we really have to do two things as people to sustain innovation and drive that thinking. And for me, that is about everybody working in healthcare and approaching everything with a challenger mindset. It's really about two things. It's about dreaming about making the impossible possible and the unable able. And I've spent enough time in healthcare to have a lot of people over time saying, it's too hard, it's too difficult, healthcare is so different. But I've also seen many inspirational people that are really changing the world and doing amazing things. And so that's something that we really need to inspire ourselves with and make that happen, because that's the root of all innovation, is that challenger's mindset. So technology is all around us, and many of the speakers have told us all about that. We're all carrying phones in our pockets and it's pervasive. Yet, it's a funny thing in the impact that it's going to have in the coming years. When we think about going digital and taking our healthcare organisations digital, we've got a long, long way to go. By 2020, there'll be 1 million new devices added every single hour. Not new phones, but new sensors, new things, new data elements, 1 million devices every hour. That's an incredible rate of growth, and it's going to have a dramatic impact on the disruption of what's going to go on. 12 years will be the average age of an S&P 500 corporation by 2020. What does that mean for all the S&P 500 companies that are on that list today? Many of them won't be in business anymore and will be replaced by new organizations that are doing that. And computing is changing from stuff that we put into our data centers to going into the cloud because of pure necessity. The volumes of data, the volumes of sensors, the volumes of stuff that's going to happen and talk to each other can't talk through the computer under your desk in your doctor's office. So significant amounts of change that are going to happen, and it's going to happen because consumers drive that expectation and believe and expect you to deliver those kinds of services. So that is what's driving the disruption of care. And it's interesting when you look at the statistics of that disruption, over time, particularly in developed markets like the United States, we're seeing the inpatient volumes over time decline, but the outpatient volumes are shooting up at a rapid rate. And so we need to think about building new models of care, not care within walls and spending all our effort and money building more hospitals and more facilities and doing those kinds of things. We have to build care without walls and build new models of care to do that. And there are two key things that are driving that. One is between visit interactions and taking those virtual, using remote monitoring, Internet of Things, devices, sensors to make that happen. And the second is, of course, virtual care. And India has been a big proponent and leader in the area of telehealth to address that very specific cause for a very long time, and is a great innovator in this space. Other areas of innovation, I think, are going to also become very exciting. Here's an example of what Case Western University is doing with the Cleveland Clinic around taking the Microsoft HoloLens and rethinking the way we educate doctors and nurses around anatomical models. And what you can do is you can stand in a room with multiple other students and be able to collaborate on a real-time anatomical model, and it sits in the room and it would stand on the stage here with you, and you'd be able to see that work. I've now got one organization in Singapore who wants to go and take this and use it for patient education, particularly for complex procedures, to help them feel more comfortable about what's going to happen and make it easier for them to visualize, because communicating it in pictures is sometimes just not enough. And they see that this is a very strong way of innovating and changing the patient experience and making that happen. In New Zealand, this is an interesting organization, and I talk a lot about why I think we do a great job for doctors. I think we do generally a pretty awful job for nursing. And nursing is often the forgotten population in IT, and we don't invest in it, and we need to do a better job of it. Plunket in New Zealand is an organisation of around 1,500 nurses that look after the children from the ages of 0 to 5. They do this work in the community. They deal with things like vaccination, coaching parents on how to look after their children, and they do a great job of telling the story around how they're driving their innovation to make things happen.
I am a Plunket nurse in Northland. I work in the Whangarei area, and I'm one of the first nurses to use the electronic Plunket health record. Basically what that is that we're now using a tablet instead of the traditional paper-based documents. On a normal home visiting day, 50% of it probably was paperwork, whereas now with a tablet, that's all gone. My day's all set up on the tablet, ready to go. Everything that I need is on there. I just come in and get any resources and then off I go. A lot of my families are like, wow, you know, we get to have it first. Yeah, they're pretty excited about that for Northland, which is awesome.
The fact that there's a text reminder service is fantastic for me. The graphs that she can show me, like I can see her growth and her length and her head circumference straight away, so I can see that she's on track for her age and her growing.
It's a sign of the times. It's just brilliant. Certainly different from my day.
This can help us all as a community and help us interlink with our families so we've all got the information. I just see the big picture and I love what I see.
I love what I see there, because for one thing that you heard, previously 50% of her day was administration. We've got a global shortage of nurses, and we waste their time doing administrative tasks when they could be helping the very people that matter the most. Our children, our mothers, our loved ones, people around us. So we need to really think about how we make a difference to that. And I think here's a great example of how technology impacts a workforce that does so much for us in the healthcare sector as a whole. There's also significant innovation happening in the area of rehabilitation. What you see here is a camera that sits above your television. It could be in your home, it could be in your clinic. But what this camera does is that it's able to see you and see you in more ways than one. It can see your fingers move. When you jump, it notices how much force you're placing on your joints and can calculate those things. And so this company in the US, Respondwell, is building a whole new class of applications to help with rehabilitation. Cameras, systems that can deliver rehabilitation programs to you in the home and measure how much your arm is improving just by you standing in the room in front of the television, or seeing how far you can jump, or seeing how far you can reach behind your neck, and showing you progress over time and gamifying that in new ways to improve compliance. So whether you're recovering from stroke or recovering from a car accident or spinal surgery and you need rehabilitation work done, these become assistive technologies in enabling us to make that happen, and enables us to take some of the burden off a workforce that still needs a lot of support. One of the more interesting things that I think is going to be a major driver for innovation, and where I think it's going to have a dramatic impact in healthcare, is the area of genomics, and particularly personal genomics. About 2 years ago, I was in a conference not dissimilar to this in Yangon in Myanmar. And it's the craziest of places to go when someone does this to you in the morning. So I get downstairs, I get down to the breakfast area, and I'm due to meet a few people. And there's a doctor there I'd met the day before, and he comes up to me and he goes, Garba, have you had anything to drink? Have you had anything to eat? Are you perfectly okay? I said, yeah, no, I'm really good. And so he rushes to his bag and he ruffles in his bag and he grabs a big swab and he races up to me, goes, open your mouth, and puts it into my mouth and takes a swab. And he goes, I'm going to sequence your DNA. I went, okay, that's pretty interesting. That should be pretty good fun. What do I need to do? He goes, we need to sign this paperwork. You need to be comfortable with this because you know the implications of genomics and you're going to find out things that you may not want to know, so you need to give me informed consent that you know what you're doing. Well, having been through this with my wife around Huntington's disease and having done all the genomic counselling, I kind of knew what kind of impact I was going to be in for. But lo and behold, I said, okay, we'll go and send it away. And he sent it away. And 3 weeks later, I get an email in my inbox saying, your analysis is complete. And here's some excerpts from that report. And it's quite amazing just the level of detail and information that we can get and the amount of data and insights that are contained within that make a significant difference. Now, you can't see it on this slide, but this is a slide that I use with my wife. This up here says metabolic versus hedonistic, in other words, overeating, and what's the major driver of my body type. And I can tell her now, without no sense of a lie, that metabolism is the driver for me, and it's got nothing to do with me overeating in the weekends. But it's an amazing piece of data to have, because now I've got this data, I can see what kind of behavior is going to drive impact for me. On the left-hand side there, you can see which drugs are suitable for me, which drugs are not as suitable for my genomic profile, and how this body of evidence starts to come together. So when you think about this and all the other data elements I have around my risk of type 2 diabetes, the risk of knee injuries, the risk of spinal injuries, what kinds of things I need to be careful of, what kinds of things I don't need to be careful of, I've now got more data as an individual than I've ever had before. But we can't expect doctors and nurses to be able to go through all this data themselves. The machines are going to have to become intelligent enough to coach the doctor and coach the patient through how to use this data in a sensible way. It's no longer going to be possible to do medicine without machines once we have this massive body of data that's coming together to make that happen. So this morning the video didn't work, and so I decided to play it again, because one of the things that I wanted to share with you is just the impact that technology can have on a family. And on a family in a condition like this, and how that makes a difference and how it saves people's lives. And this is really about innovation that every one of us does every day in this room and thinks about and making a difference and trying to do something better. And I think they've done an amazing job of this, and you hear it from the family. Often we don't hear from the family, and they do a great job of telling their story.
I think in the back of each of our minds we were planning a little funeral, and just didn't know where it would go after he was born. Winston was diagnosed with HLHS, which is hypoplastic left heart syndrome.
1 in 100 to about 125 babies are born with heart disease every year. And out of those, about 1% are born with half a heart. Out of all the heart surgery we do, this is the most high risk.
They lose about 25% of these babies in between the two surgeries.
The standard of care at the time was to send these families home with a weighing scale and a pulse oximeter and a 3-ring binder, and they were asked to record measurements of their baby every day.
There would have been a lot to juggle and learn on our end, just as new parents. And then we added all these things in that really increased the stress level.
So we needed a method that we could actually send something home with the parents so that we could better monitor and be alerted if there were conditions that we were concerned about with the patient. We have a Microsoft Surface that we load our software on. We call it CHAMP. We decided we wanted to use a modern app with Windows 10 as the operating system.
We would log all of his vitals, and that app became this seamless piece to his care.
With the daily reports that come in from the Azure cloud, if anything is an outlier that needs to be notified to us immediately, it'll alert us.
The tablet already has a camera, and we said, why not get video every day in addition to all the other measurements and just see what that does?
One of the things that saved Winston's life was the 15-second video.
When we were looking at his information, he had a couple days of not gaining weight. He was breathing a little bit harder, and he just wasn't happy on his video.
They could pull it from when he was doing fine and saying, okay, a couple weeks ago, this is what he looked like. Now he looks like this. We think it is part of his aorta.
They did the procedure the next day, and then I think he went home the day after.
There's still that underlying piece on the back of your mind. You're going, this is major heart surgery.
I mean, it's a scary thing to think of what could have happened.
This technology literally saved his life.
The first time that I heard a child's life had been saved with CHAMP, I left the room because I kind of needed to tear up in private because it was a dream that I'd had for a long, long time.
We've learned so much, and it's changed our practice and made us more efficient, but also saved lives, that we want to roll out nationally to other children's hospitals that do cardiac surgery.
For everyone behind the scenes, we're very thankful for it. Saved his life, and how do you say thank you for that?
So that hospital hasn't lost a child since that application was implemented, and I think that's an amazing result, and it shows how small incremental changes in technology can have an impact. The last one I want to talk to you about is really the area of the innovation that's happening in home care. The home care space is a really interesting one, and this is a company out of Singapore called Silverline. Now, for those of you who've been to Singapore before, you know that many people live in what's called Housing Development Board flats, and there's huge communities there, and Singapore has the third fastest aging population in the world. And so they have real challenges around how do you support people living at home. In most families, both husband and wife are working. Trying to look after the elderly is challenging. How do you ensure that your mum's looked after or your father's looked after and doing those things well? And this company is going and tackling that problem and saying, how do we do that, and how do we do it cost effectively where everyone can be part of the care team and make a difference? And so with simple engineering and low-cost devices, they're starting to be able to transform the kinds of offers that are in the market to be able to do this in their own home. A gateway device, this gateway when it was first released was $300. This gateway is going to be a quarter of the size soon, and it's going to be $80 and do more. There's a couple of devices here, like the little sensors that you see below the gateway. It's a little accelerometer, it's waterproof. You drop it in your toilet cistern, and if you want to monitor how many times someone's going to the bathroom at night, every time it flushes, this sensor talks and says, I've gone down and up, and it increments it, and all of a sudden starts to collect data. Little purse sensors that'll turn lights on when there's movement and so forth. You have them in hotels, but now we can cost effectively do it in people's homes. It only takes an hour to set up an entire home with these types of solutions, and all of a sudden we can start to build solutions and services that enable the individual, the elderly person, the family caregiver, or you or your mum, your sister, to be able to see what's happening and interact with them, and also the clinicians. and give a group service the ability to be able to pull all that data together and be able to look at it regionally and monitor people for alarms and events and be able to do that simply. And this can be done cost effectively and simply with technology to be able to make that happen. So for Singapore, for about $40 a month, you can have a full service running using your existing phones and mobile devices, and all that data will be aggregated and be shared with you to give you data and insights and rich response workflows and so forth that can really make a difference to supporting the elderly living in their own homes. They're now doing some really interesting work with the Schön Clinic in Germany around Parkinson's disease. And they're using bands or sort of Fitbits or watches or Microsoft bands and being able to take the tremor data from that and applying those through machine learning algorithms and being able to start predicting falls for Parkinson's patients and trying to intervene before it happens. So the trial has been so successful, this is now being expanded across Germany and Singapore. Real innovation, applying things that we see in our consumer lives, but applying them to real clinical problems. And this is going to usher in a whole era of new innovation around a number of key areas. So as we move forward, the three things that we think you need to think about are really going to be centered on these things. One, we need to do a significantly better job of enhancing the patient experience, but also enhancing the clinician's experience of how they use technology. And we've got a long way to go in this, and I don't think we're quite there yet. We're seeing a lot of cool innovation, but we've got a lot of work to do in this space still to get it right. The second is we produce more data in healthcare than any other industry combined. So much data is created in healthcare, but we do a pretty average job still of using that to inform insight and drive practice. And so if we want to become better at what we do, take cost out, provide better care outcomes, we need to become much more predictive and use the data that we have to be able to drive that and turn that into insight and advice to really support the whole care system as a whole. And as that moves into precision medicine and using genomics and so forth, that becomes even more important in how to make that happen. And then the third, of course, is transforming into a digital system and really having a war on paper and crazy processes that have been there for 80 years because that's how we've always done it. We can do it that way. Really having a war with that and saying, is that the right way to do it? And it might be the right way to do it. Paper might still be the best system, but have and ask the question, could we do this differently? And if we were to redesign the system today, how would we do it? And I know that in India, you're all innovating every single day, thinking about that, challenging the system, challenging how we do things, using technology to disrupt and change the way we do care. So I'm really excited about the future we're building together and the future that you think about every day and the future that you play a role in. We look forward to being a part of it and making a difference. Thank you very much.